Hi everyone, this is Dr. Schroeder with this week's video introduction to week number 6 of our course in evidence-based practice. And well, it's been kind of a quiet week in the class. There was no discussion question this week, so really the only real activity in the classroom itself has been in posting and getting some answers on some questions. Had some good questions come up on the evidence-based practice part 2 paper that we'll be due this week. I've also had an opportunity to help clarify and give some feedback via email. So if you have any questions, please feel free to send them to me. I'd be more than happy to help you with this final aspect of your paper. The discussion question this week is actually built or developed to be part of your paper, which is the identification on what are some of the barriers and what are some of the resources that you would need to be able to implement your evidence-based practice protocol. Now remember, the idea here is that you're going to be developing a plan for implementing, and that this is actually really in the real world probably the longest part or the hardest part of the whole process is just planning how you're going to do it. For many of you, you have chosen sometimes it's a intervention that requires new equipment. If you are, for example, using some, piece of equipment that's going to supersede something else that's been used. For some of you, it's a new protocol, a new education or training program, some new educational materials, all of these sort of factors. Those all have to be developed and planned, and it has to be determined who's going to develop them. If you're going to come up with an education program for patients and family and for staff, okay, who's going to train them? How much is it going to cost to train everybody? How long is the training going to last? If you're going to have a 2-hour training for everybody, and your average nurse is making $30-ish an hour plus benefits, and $60 per head, how many nurses are you going to be training? How much is that going to cost? How much lost productivity, how much overtime do you have to pay somebody? So these are all things that need to be taken into consideration. And so those are the sort of things that you're going to be discussing. Also, identifying a champion, identifying somebody who can really take the lead with a new practice is really important. And these are all things that you're going to be talking about in your evidence-based practice part 2 paper. I want to point out one thing. There are 2 tables to complete in this paper. One is you're going to be coming up with a evidence-based practice implementation plan and then an evaluation plan. Think of it this way. The plan itself, or your implementation plan, is what are you going to do before you actually start that new practice? Who do you have to train? What resources do you have to get? What protocol or what policies have to be written? Who's going to be responsible for doing those? Be as specific as you can. And you're going to come up with a measurable, observable goal for that. Typically, for example, in a case where you have a case where everybody needs to be trained on a unit in some new protocol. Maybe it's a new fall protocol. Maybe it's a new communication tool. Everybody has to be trained with that. So how long are you going to take for that training to take place? Your goal would be something along the lines, or one of your goals anyway, would be something along the lines of 100% of the staff will be trained, and the educational materials will accurately convey what is necessary to implement that protocol, or that the new medical device or the new materials that are needed will be ordered. And then the second table discusses your evaluation plan, and this is how you evaluate those outcomes. So why I told everybody it's really important to come up with a full P code, including the time frame, because this is going to be included in this particular table. For some of you had for example, if you had a P code that was going to be over a time frame of 6 months, so this is kind of your 6-month plan. After 6 months, what are the outcomes that you expect to see? How are you going to measure those? What is it that you're going to be looking for? And so that's what those 2 tables are. I think that probably, having taught this class and done this assignment many times before with many other students, the one thing that probably trips everybody up is those 2 tables and understanding what those 2 tables are for. So I just wanted to give you that direction here. And so we're back in class with the discussion, just a couple more weeks to go. So again, I look forward to participating in class with you. If you have any questions, feel free to go ahead and post them, and I'll look forward to seeing you in the discussion forums.